everyone, I am Claudet Pornuevo, your second year student nurse from Our Lady of Fatima University. So for today's video, we're going to perform immediate newborn care return demonstration. So immediate newborn care is a series of time-bound, chronologically ordered. So this is a standard procedure that a baby received from birth. So all newborn requires immediate newborn care to minimize the risk of disease or illness and to maximize their growth and development. So before proceeding to the procedure, make sure to prepare all the necessary materials. So I have gathered all the needed materials including this basin. So considering or assuming that this is a kidney basin, alcohol, a vitamin K, eye ointment, hepatitis B vaccine, tape measure, cotton balls, a gauze pad, prepare 2 pieces of umbilical cord clamp, surgical gloves, and prepare 2 pieces of scissor and or forceps, and also weighing scale. So also prepare the baby's clothes including the sock, mittens, shirt, bonnet, and sterile clothes. And also lastly, a stethoscope. So prior to the conduct of this procedure, I have performed hand washing to protect myself and also my client and also her baby to any infections and to avoid or prevent cross-contamination. So things that we nurses must need to do is to put sterile gloves and clear and loudly call for the baby out, including the time and gender. And then when the baby finally comes out from the mother's uterus, initiate skin-to-skin contact of the mother and her baby. And then place the baby under the chest of the mother, so facing the baby's head to the mother's breast. And then while the baby is on the mother's chest, cut the umbilical cord, so clamp 2 to 3 cm from the umbilical base and clamp another 5 cm from the umbilical base, then cut the near 2 to 3 cm clamped umbilical cord. So after that, perform Apgar scoring while immediately drying the baby, and then put dry blanket after removing the wet blanket that we used to the newborn, and using the tape measure, do anthropometric measurement, including the head, chest, and abdomen circumference, and including also the body or body length and or the height. So get for the baby's weight using the weighing scale, and then check for the patency of the baby's anus using the rectal thermometer. After the assessment of the baby, administer eye ointment, then administer the vitamin K and hepatitis B vaccine. So after administering all the necessary medication, put the baby's clothes including the bonnet, sock, mittens, and shirt. So put or place a identification band or bracelet, and then don't forget to place the baby under the drop light so that she or he will make comfortable and warm. So that's it. Let's do this. Baby girl out, 3:16 p.m. September 11, 2021. And clamp another 5 cm from the umbilical base. Then cut near the 2 to 3 cm clamp umbilical cord. So dry the baby to prevent the development of hypothermia or cold stress. So hypothermia should be avoided because it is associated with perinatal respiration stress. So while drying the baby, do the Apgar scoring. So the baby's color is pink and she is flexing her arms and legs, and she is sneezing and crying. She's vigorously crying. And let's check for the pulse rate. Now I'm going to get the baby's weight using this weighing scale and placing the baby in this weighing scale. Now let's check for the baby's anus patency using the rectal thermometer. So replace a new dry blanket for the sanitation of the catted umbilical cord. So for the cord dressing, make sure to put sterile gloves and then properly restrain the lower and upper extremities. So now using the cotton ball soaked in alcohol, disinfect the cord 3 times from the base upward. Now, place gas pad at the base of the cord and clamp the umbilical cord 1/2 inch from the base of the cord. So now, cut the cord 0.5 centimeter above the clamp cord and express the remaining blood from the cord with the gas pad placed on the base of the cord. Now, place a new gas pad at the umbilical base and pour 70% alcohol over the cord. So now get a tape measure and check for the circumference of the newborn's head, chest, abdomen, and the body length. So the normal circumference of the head is ranging from 33 to 35 centimeter, and the chest of the baby is 30 to 33 centimeter, same as with the abdomen's circumference. And for the length of the baby or the newborn, the ranging circumference is 50 to 51 or 52 centimeter. Now that we're done doing or assessing the anthropometric measurement, let's proceed to the administration of the medication. So, administer eye ointment to newborn. So, this is to protect the newborn from getting bacterial eye infection that occur during birth. Now, administer vitamin K using syringe at her anterolateral right thigh. So vitamin K provide protection from the bleeding that could occur because of low levels of these essential vitamins. Then, lastly, administer hepatitis B vaccine 0.5 millimeter to protect the newborn against hepatitis B that she may get from her mother. So hepatitis B is a potentially serious disease. finally, put the baby's clothes including the sock, mittens, bonnet, and shirt. So don't forget to put an identification band to the ankle of the newborn. So this is to prevent the contact of the band or the identification band to the newborn's mouth. So don't forget to place the baby under the drop light to keep her warm and to avoid the development of hypothermia. Now, I'm going to check for the baby's heart rate or the vital signs of the baby, including the heart rate, pulse rate, and the respiration rate, also the blood pressure and the temperature. And now document the finding. So the baby girl out at 3:16 p.m. on September 11, 2021, and the umbilical cord contains one vein and two arteries. So for the Apgar score, so for the appearance, 2 points for the appearance because the baby's color is pink. So for the pulse rate, 2 points because it is 150 beats per minute. For the dryness, 2 points because the baby is quickly responding when pressing, and she is crying and sneezing. So for the active reflex, 1 point because the baby limitly flexes her arms and legs, yet it is symmetrically. So for the respiration, so 2 points for the respiration because the baby is vigorously crying and 60 respiration per minute. So Apgar total score of the baby is 9. So this is to conclude that she is in a good and normal condition. So for the anthropometric measurement, the head of the baby's circumference is 34 centimeter. For the chest, 32 centimeter. For the abdomen, 33 centimeter. Height is 50 centimeter. And for the weight of the baby is 4,000 gram. And for the anus patency, 37.2 degrees Celsius or 99 Fahrenheit. So for the vital signs of the baby, for the temperature, 37.2 degrees Celsius. For the heart rate of the baby, 160 beats per minute. And for the respiration rate, 60 respiration per minute. So assuming that we check her blood pressure, so for the normal blood pressure of the baby is 60/40. That's all for today. Thank you.